Hello, I have another story. I love my patients so much, and many of my patients have seen tons of practitioners. They've seen like 6 rounds of physical therapy. So I have a phenomenal patient coming in, and a couple underlying pieces. We've got absolutely some inflammatory issues. So we're dealing with back pain with this particular patient, and absolutely there's some underlying inflammatory issues you can see through the skin. You can see through the skin that we've got probably either detoxification or some GI issues. So all of that points to we've got an inflammatory component that we have to address for sure, for many, many reasons, not just to overcome the back pain, but also to make sure all systems are as healthy as possible so other things don't creep up down the road as far as other health issues that we see commonly today, especially here in the US. So we are struggling. There's a big alignment piece for this particular patient. So the lumbar spine is under constant load, constant shear force, and exacerbated by extension. And as soon as we try to lift our arms up, it goes right into that low back. So we're working on mobility throughout the whole system through the Engage program. I am working on helping mobilize the dural system because there's significant dural tension throughout the system, which also contributes to the tug of war and irritation. We've got some wicked strain on the discs because he's presenting with disc symptoms and radicular symptoms. But what was important is as I'm treating this person had a flare-up. They said, oh my gosh, my back got worse. So what's important is what happened? What did you do? And again, there's no blame, but just we want to understand what happened environmentally, externally, that tipped your body over, especially when we're unburdening the body. We're getting tension off. You're working on your stability. And really there was nothing significant. There was no chopping of wood. There was no moving a mattress. There was no big heavy stuff that might have irritated the disc. But I said, let's talk about your workout. And there was one new thing that the person did in the workout. But I said, let's look at the workout. And I was really pushing hard because I wanted specificity. What exactly are you doing? And the person would tell me, yes, I do some tricep work. I'm like, but what exactly did you do? Because we need to know mechanically what your body was doing with repetition that probably irritated your back. So as this person showed me some of these movements, holy moly, wow. Each time, and we didn't even bring load or weight, but each time this person went into demonstrating and do multiple reps, it sheared right into the back. And I said, you know what? We got to back off on this. And some of those, he's like, well, some of these are from what my physical therapist gave me. I'm like, stop that one, stop that one, stop that one. Honestly, stop everything right now, because we need to get strain off your back. Your back continues to be irritated. And so it was such a dance on yes, I want you in the gym, and that's super important for many reasons, for mental, emotional health, for well-being. We need people exercising, but we have to be exercising within the range and limits that your body can handle. And the whole no pain, no gain is BS, because your back should never hurt. And of course, this person said my back doesn't hurt when I work out. I'm like, yeah, it doesn't, but the next morning you're still stiff. Or it didn't take much to tip your back into a flare-up. So each movement, one movement by itself doesn't bother, but when you do 10 reps times 3 sets times a couple more, it's that repetition that accumulates, irritates. So when we're in the gym, we have to be cognizant of what our body can do and cannot do. And I said, this is just where you're at right now. Someday, yes, we can go into some of these other things, but we need to improve mobility, range of motion to access these positions that you want to get into. We need to help with stability. We really need some true good stability. So how can we work out safely, healthily for that back so we can start to regain that health, that stability, and protect that back? We've got to protect that back. So important. As you want to get in the gym, you've got to learn your foundational mobility, stability. You've got to know how to keep your back healthy, how to keep your shoulders healthy, how to keep your knees healthy by learning how to improve fascial dural length throughout your whole body so that you can get into alignment with ease, and then learning how to bring stability in and keeping those neutral positions with healthy stability. This is not just bracing and holding tight, holding your core. That's not your core. When you learn how to engage and stabilize and align, your body automatically does what it needs to do, and it can handle load that you bring into it. But many people I see in the gym, they are getting hurt. And if they're not getting hurt that particular day in the gym, over time, this stuff is going to start to bite them in the butt. We're going to start seeing the knee pain. We're going to start seeing the back pain, the shoulder pain, the neck pain. Again, it's because of repetitions and load on inefficient mechanics feeding into these compensatory